we are going to be patronizing them. And by so doing, we are creating employment opportunity in such companies. And how are we going to be doing that? We are going to be partnership with some of these foreign investors, like WHO. They are there for us. They can assist us if we actually go to them. And we are going to make sure that all our hospitals are well equipped. That is what we're going to do. Thank you.
All right, thank you very much. You still have 3 seconds, but let me take it to the Alliance for Democracy candidate, Mr. Gbenga Akintola. Of course, Mr. Odele Mercy has just raised some issues here now. He's talked about lack of drugs and the need to get local manufacturers involved in the manufacturing of drugs. Take it from there.
Yeah, thank you very much. The major problem we have is the fact that virtually all the primary health care centers, which is over 1,000, servicing 4.24 million Osunians, are located in the grassroots, in the local government areas. What is important is access to these facilities. I'm going to use the direct labor of our government to ensure that we provide, make sure that the roads are accessible. Because when you spend time to get to the victims or the patients, you will kill people. I'm going to save life by making sure that access to these facilities, the roads are motorable. And secondly, the welfare of the medical staff is something I am going to look into. We have the issue of comments. That's the consolidated medical salary system. That is still an issue for the past 10 years. It is yet to be resolved with the medical doctors. This is there. We need to look into that. Not just medical doctors. Other members of the teaching, medical staff, pharmacists, technicians, nurses, and what have you. And what is equally important as well is that we measure insurance. Everybody's mentioning insurance. But at what cost? I have experience in ensuring that the insurance facilities that's going to be made available to our people is as little as 100 naira per month. This is something I have done before in the other states that I've worked. And also,
I wonder how you plan to do that. How realistic is that?
100 naira a month.
Okay.
This is what you use to buy pure water or to buy a bottle of water. If you can get that aside in 1 month, that will give you access to a lot of medical services. But most importantly,
I'm talking about the purse. Which purse are you going to take it from? Are you taking it from the citizens, or you're going to just set aside some monies as when you're government?
It's a combination.
Okay.
It's going to be subsidized by government, but the citizens have a role to play. But what is important as well is that I've already leveraged on development partners where I've provided a lot of medical services to our people free of charge in the last 6 years. And also, I donated drugs to all the major hospitals of the state. So I have that experience of how to attack our medical issues in our state.
All right, thank you very much. Now to the candidate of the COA party.
Yeah.
What will you do to turn around the narrative in the health sector in Osun? Of course, the other candidates have talked about lack of access to health centers, which Mr. Akintola just raised. I mean, what's the use of even building fantastic health centers if there are no roads, if they're not accessible?
Yeah, the approach I'm going to use is that we are going to develop mega medical centers, mega hospitals. They're going to be fee-paying.
Are there going to be mega hospitals that will be empty?
No. I'm saying which will be fee-paying, that will encourage medical tourism into Osun State. The profit we are generating from there, we are going to use it to finance our health insurance for our people. Because the people that can afford to pay, they are going to pay, and we are going to provide tertiary medical facilities, tertiary medical services. And then the profit that the government is getting from there, we are going to use it to finance health insurance for the free medical care at basic level. So that's why we are going to generate the fund. And we are going to ensure that all our people have access in terms of funding. Because you may even have access. The hospital may be close to you. You don't have the resources, the money to pay for the drugs. You don't have the money to pay for the consultation. We are going to ensure that there are accessibility in terms of funding. They have out-of-pocket expenses. We are going to make it available through our health insurance scheme. And how do we get the money from? Because we are going to base it on investment-based development policy. That's not a debt-based development policy. We can't depend on the federal allocation to finance our health sector. But when we get mega hospitals that are fee paying, it can encourage medical tourism from outside the state, outside Nigeria, and then the profit we are getting from it, we are going to use it to fund the basic education. That is the approach we want to use.
To fund basic education or health?
No, basic health sector,
All right,
especially the insurance, the health insurance for our people, for the local people.
All right, thank you very much, candidate of the COA party there, Professor Fabi. Let me bring this back to Mr. Oyetola. I always have to bring it back to you because you're part of this administration. Yeah. You've been described as the life and soul of the Aregbesola administration. Now, talk to us about some of the issues they have raised.
Yeah.
I'm trying to even look at one of the major issues that they raised now, the lack of access to health centers. And I want you to even bear in mind that 70% of the black doctors in the United States are Nigerians. And I can be sure that a major chunk of them actually come from Osun State. I wonder what you'll do to bring them back home, to make the health,
Yeah, thank you.
Yes.
First of all, I believe that there is enough access to all the primary healthcare centers. What is important
access in what way now? Are you
terms of
saying there's
roads.
access to funds like Mr. Fabi raised?
In terms of roads,
Roads, okay.
yes, they are sited in rural areas where people have access to the primary health centers. What is important is to ensure they are reactivated in a way that you have necessary facilities to at least take care of the needs of the rural area.
How will you reactivate them?
Well, first, for instance, you want to see what is lacking in any of the primary health centers and address them squarely.
Are you able to say right now what is lacking in those health centers since you've been part of the system?
Well, it's actually an ongoing thing.
Okay.
There have been a lot of visitation by medical doctors to some of these places, visitation by even the Commissioner for Health to bring up possibilities of any of those things that are lacking. So once we're doing that on a continuous basis, but if for whatever reason there's a particular thing that is lacking in any of the primary health centers, we'll fix it. That's why I'm talking about reactivation. Again, one thing that has been missing that people are not talking about is the introduction of the ambulance services, which is a 24 hours service. It has actually helped to reduce the possibility of people dying.
What about the modulated salaries for doctors that a lot of people are linking to the, deep in the health sector in Osun?
This is a temporary thing. Okay. We are getting out of it. And we've started paying full salary. So it's innovative given the situation we find ourselves. And it's not peculiar to Osun. It's virtually in all parts of the country. It's a period that we are getting out of.
Thank you, sir. Your time is up. Let me take it to the... Mr. Batunde, you were shaking your head there.
Yes.
Batunde is of the Labour Party, of course.
Yes. I want to respond to what he just said.
Yes. Please project so that people can hear you well.
Yeah. He just said something about it is temporary. I can't believe...
That's a temporary challenge in the modulated salary thing for the doctors.
Exactly.
Yes.
I can't believe we're actually talking about that. You know why? Our doctors are next to God, and you're paying them half salary. It is a crime. It is not done anywhere in the world. These are doctors. These are nurses that are taking care of people. They must be paid. In fact, we have shortage of doctors and nurses in Osun State. I'm seeing some doctors and nurses around now. They came from Lagos for primary health care. How can you be bringing people from Lagos? There's a problem in Osun State. We need to deal with it. So I'm asking my father here, my uncle here, that if he gets in, he should tackle that. Although I'm going to get in anyway.
I almost thought you were on a platter of gold already.
But what I'm saying now is,
Please, audience, abide by the rules. Please, thank you. We appreciate you have been cooperative so far. Yes, please, very quickly.
Thank you. So what I'm trying to say is there is a gap and we need to fix it. We need to bridge the gap. And now, the doctors, we need to employ more doctors and nurses. Our people are suffering. Our people are dying. The truth must be told.
Okay.
We need to get more doctors. Thank you.
All right, Mr. Akintola of the Alliance for Democracy. Mr. Oyetola of the APC says the doctors are being paid now, especially with the release of 19-point-something billion already to pay off all those salaries that have been outstanding in the last 4 months. What really, can you fault that?
I think we should not be joking with the lives of our people. This is actually serious business. We are talking about lives of our people. We must not toy with that. How do we pay the salaries, not just of medical staff, not just of teachers, but most importantly, all workers that have paid their own dues by providing 30-day service and they're not getting anything back? This is the issue here. I'm going to restructure the terms and conditions of the existing loans to free up some money. I'm going to revitalize our economy. I'm going to leverage on farming to manufacture, the value chain addition. I'm going to leverage on the existence of what God has given to us, solid minerals, exploration, development, and what have you. I'm going to leverage on the benefication of solid minerals in our state. I'm going to leverage on tourism. When we put food on the tables of our people, when we enhance them economically, this is what we are talking about. We must make sure that our medical staff, right from doctors, consultants, up to the technicians, they are given retraining and retraining, and to ensure that we leverage on our development partners, which have been doing in the last 6 years, to provide assistance in the area of training our medical staff, and also to ensure that they assist in the provisions of the necessary equipment for our various hospitals, especially the primary healthcare centers. Also, we must give support to our local government, because we need to look at the legal framework that currently exists between the state and the local government. This is where the challenge is. The local government don't have access, they don't have easy access to the funds that the Constitution allows them to have. And these are the things we need to look at. There are various, 3 times they've tried to amend this particular legal framework between the states and the local government in areas of finance, in areas of funding. We need to look at this very critically. This is the issue that we must deal with, because if you don't do that, we're still going to have a problem. I promise you, I'm going to deal with that. All the legal issues challenging, dealing with the issue of revenue between the state and the local government will be resolved once and for all. Thank you very much.
Okay, thank you very much, the candidate of the Alliance for Democracy there, Mr. Gbenga Akintola. Just to inform our viewers that we did invite the candidates of the PDP and, of course, the candidate of the ADC and the ADP. They really did assure us that they will be part of this debate. And, of course, the candidate of SDP too. 4 party candidates, they have failed to show up. The gentleman that you see and the lady here, we also extended an invitation to them, and they did give us their word that they will be here live in this debate, and they have kept to their word. Just to let you know, in case some of our viewers are wondering why the candidates of the PDP, ADC, ADP, and of course the SDP are not here to speak to the people, to tell the people of Osun exactly what they will do in the next 4 years, considering the fact that they have not pulled out of the race. Just to put that out there. All right, let me very quickly to Professor Fabi. You have 1 minute to say something about what they have raised concerning the challenges in healthcare and how it will be fixed. Very quickly.
Yeah. Let me say something about the modulated salary structure. That thing is not only immoral, it's not good. Because
yes, we do.
Salary
yes.
is the major.
That's understood. That has been established. But what exactly will you do differently so that Osun State does not come back to that position?
Must be paid promptly. That's why I said the development philosophy we are going to adopt is a profit-based or investment-based approach. For instance, I used to give an illustration of the bridge that was put on Bergen Road, or along the express in Bergen. If you put that fund in establishing a factory in Burgos town, and you ask them, just the management of that factory or that industry, that you use the profit that's supposed to accrue to the government to build this bridge in 6 years. We will have our factory and we will have our bridge in 6 years. And if the government will not go a borrowing, there's no way we'll continue to develop our infrastructure without borrowing. But when we tie a particular development to a project, it is to an industry or factory, it is easy to develop our economy with ease.
All right, the candidate of the Restoration Party, thank you very much, Ms. Ayodele Mercy. You have 1 minute to round off on this so that we can take another break.
Thank you very much. You know, when my brother here, when he was speaking now, I was busy
I wonder
shaking.
which of the brothers you're talking about now. Mr. Abatunde of the LP?
I was busy shaking my head because he has already accepted defeat.
No.